We do know a lot of you have questions about when more people will be allowed to sign up or whether there'll be even enough doses for everyone to go around. Well, Fox 59's Darius Johnson is getting some of those answers for us.
I understand this is tricky and there's a lot of new information daily, but that's why we're here to help. Today we're going to focus on how the state prioritizes who gets the vaccine and how the health departments are managing those doses. Right now in Indiana, anyone over the age of 70 is eligible to register and get vaccinated. The state is prioritizing who gets the vaccine first based on work environment, age, and underlying health conditions.
Age alone is a very strong risk factor for both hospitalization and death related to COVID-19.
Dr. Michael Weiner, research scientist at the Regan Street Institute and professor of medicine at IU, says prioritization is based on the data collected during the pandemic. That plan comes with pros and cons.
There will always be some individuals who don't completely fit the risk profile, even though they may meet an age criterion.
Then there are some older individuals who might be healthier, putting them at a lower risk. And it's up to the state how much vaccine each location gets.
So whatever vaccine that we're providing now, we usually are given a week or a 2-week time frame that vaccine has to last through.
And the state is tracking what's allocated so it can be doubled for the second dose as Hoosiers worry what may be available.
The state is in charge of all of the inventory and all of the send out of the doses. So there is not a way for example, for a hospital to order their own.
As the state continues with an age-based priority list, some experts say distribution needs to be ramped up and more widespread.
I think in the long run, it would be useful to try to increase that flexibility and accessibility, maybe by considering additional channels for where the vaccine can be received.
Now, the Fishers Health Department plans to open their mass vaccination site next week. Every health department in the state is opening sites and vaccinating based on the number of doses being received. Reporting in Indianapolis, I'm Darius Johnson.
All right, Darius, thank you. Well, the state health department is also working to make sure as many people have access to the vaccine as possible. The available supply is decided by the federal government.